Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I have been asked many times that what is the impact of Eid-ul-Adha on patients with liver diseases. So today we shall discuss impact of Eid-ul-Adha on patients with liver diseases. We know Eid-ul-Adha is a significant religious festival in Islam. It involves traditional practices and food offerings that may impact patients with liver disease. Considerations for these patients include: number one, fatty food consumption. Traditional Eid foods can be rich in fat, which may worsen liver disease symptoms. Patients should opt for healthier options. Number two, hydration. Adequate hydration is crucial, especially during festivities. Patients should drink plenty of water and limit sugary drinks. Next, medication adherence. Patients must maintain their medication schedules and dosages, even during celebrations. Next comes physical activity. Moderate physical activity like walking is recommended, but excessive exertion should be avoided. Next is food portion control. Patients should practice portion control and avoid overeating, which can exacerbate liver disease. Next comes awareness and support. Family and friends should be aware of the patient's condition and offer support and encouragement throughout these celebrations. And last comes medical advice. Patients should consult their healthcare provider for personalized guidance on managing their liver diseases during Eid-ul-Adha. Thank you.